Can your eye pressure ever be too low? Hi, I'm Dr. Nagori. I'm an ophthalmologist and a glaucoma specialist, and you're watching the iFacts.com channel. Now, as a glaucoma doctor, I'm usually focused on lowering eye pressures. Patients with extremely low eye pressures are not very common, but it can happen in certain situations. Let's take a look. The first situation is in the case of an eye that's been injured or severely diseased. In this case, the eye no longer functions, there's no useful vision left, and the low eye pressure is insignificant because the patient doesn't have any useful vision, and so there's really nothing to do there. The only case that we would do something or prescribe some sort of eye drop for that eye is if the patient's eye was very uncomfortable. And in those situations, we treat the discomfort and not the vision loss. The second situation in which a patient can have low eye pressure is after having glaucoma surgery. Now, in some situations, the glaucoma surgery may work almost too well, and the eye pressure can get a little lower than we'd like to see. And in this situation, your glaucoma surgeon will do a few things to check on your eye pressure. One of the most important things that your surgeon will check is to see if there is a leaking wound from the surgery. Now, if there is a leaking wound, there are different ways to raise the eye pressure, and that will be determined by what exactly is happening behind the microscope when your surgeon takes a look. Now, glaucoma surgery can be complicated, and glaucoma surgeons are often walking a tightrope when it comes to your pressure. They certainly don't want the pressure to be too high, but they also don't want it to be too low. So, what happens when you have low eye pressure, like extremely low eye pressure? So hypotony maculopathy is a condition that can happen if your eye pressure is really low. It is not very common, but it certainly can happen. Hypotony means low tone, and maculopathy means that there is a problem with the macula. The macula is the central part of the retina that really allows you to have clear central vision. Folds can develop in the back of the macula, making the central vision blurry, and it can happen sometimes around a pressure of 6 or lower than 6. Now, overall, for the average person watching this video who hasn't had major eye trauma or hasn't had glaucoma surgery, having a low eye pressure is really pretty uncommon and unlikely to happen just without a cause. So low eye pressure for the normal average person is really not something you need to worry about. Hope you found this video helpful. Please support the channel by liking and subscribing below, and I'll see you next time.